If you are watching this, you are probably paying more for Medicare than you should be. Most people have no idea. They picked a plan during enrollment, trusted their agent, and never looked back. But Medicare costs changed in 2026, and the plan that made sense last year may be quietly draining your retirement right now. In the next 10 minutes, I am going to show you the 4 questions that expose whether your current plan is costing you too much and exactly what to do if it is. Stay with me because number 3 is the one most people never think to ask.
The first thing you need to understand is that comparing Medicare plans is not one decision. It is actually 4 separate decisions made in a specific order. Get the order wrong, and you end up comparing the wrong things entirely. So let us walk through each one. Decision 1, Original Medicare or Medicare Advantage. This is always the first question, and it is the most important one. Before you compare any specific plan, you need to decide which system you are choosing. Original Medicare means the federal government covers your care. You can see any doctor in the country who accepts Medicare. No network, no referrals, maximum freedom. But you will have gaps in coverage, which is why most people add a supplement plan on top. Medicare Advantage means a private insurance company, approved by Medicare, manages your coverage instead. Everything is bundled into one plan. Often includes dental, vision, and hearing. Often has a $0 premium. But you are restricted to a network of doctors. You may need referrals to see specialists. And your out-of-pocket maximum in 2026 can be as high as $9,350. Ask yourself one question to decide. Do I have doctors I want to keep seeing? If yes, Original Medicare gives you that freedom. If you are flexible on doctors and want lower upfront costs, Medicare Advantage may work for you. Decision 2. If you chose Original Medicare, which supplement plan do you need? This is where most people get confused. There are 10 standardized Medigap plans labeled A through N. But in 2026, most people are choosing between just 2, Plan G and Plan N. Plan G is the most comprehensive option available to new Medicare enrollees. It covers everything Original Medicare does not, except the Part B deductible of $257 per year. That is the only thing you pay out of pocket with Plan G. Plan N covers the same gaps as Plan G, but requires small copays of up to $20 for doctor visits and up to $50 for emergency room visits. In exchange, Plan N premiums are typically $30 to $50 per month cheaper than Plan G. So how do you choose between them? If you visit doctors frequently, Plan G gives you predictability, one deductible per year and nothing else. If you are generally healthy and visit doctors rarely, Plan N saves you money on monthly premiums. Run the numbers for your situation. How many doctor visits do you average per year? Multiply that by $20. Add $57 for the Part B deductible. If that total is less than the premium difference between Plan G and Plan N in your area, Plan N saves you money. If it is more, Plan G is the better value.
Decision 3. Which insurance company should you buy your supplement plan from? Here is something most people do not know. Medigap plans are standardized by the federal government. That means a Plan G from Company A covers exactly the same things as a Plan G from Company B. The benefits are identical. The only difference is the price and the company's reputation for rate increases. So when comparing companies, look at 2 things only: the current monthly premium in your zip code and the company's history of rate increases. A company with a low premium today, but aggressive rate increases every year, will cost you more in 5 years than a company with a slightly higher premium now. Always ask the agent or company, what was the average rate increase for this plan over the last 5 years? That number tells you more than the current premium does. Decision 4. Which Part D drug plan do you need? This is the most overlooked decision in Medicare.
And it is also the most personalized one. Do not pick the cheapest Part D plan. Pick the plan that covers your specific medications at the lowest total cost. Here is how to do it correctly. Go to medicare.gov. Click on Find Health and Drug Plans. Enter your zip code. Enter every medication you currently take, including the exact dosage. The tool will calculate your total annual cost, including premium plus copays, for every Part D plan available in your area. Sort by lowest estimated annual drug cost. Not lowest premium, lowest total annual cost.
That is your plan. Do this every single year during open enrollment, because drug formularies change every January 1st. A plan that covered your medication cheaply last year may not cover it the same way this year. Now let me give you the complete comparison checklist. Before you choose any Medicare plan in 2026, answer these questions. 1. Do my current doctors accept this plan? 2. Are my preferred hospitals in-network? 3. What is the monthly premium? 4. What is the annual deductible? 5. What is the out-of-pocket maximum for the year? 6. Are my current medications covered on the formulary? 7. What is the copay for specialist visits? 8. What is the company's rate increase history over the last 5 years? 9. Does the plan include dental, vision, and hearing if I need those? 10. Is this plan available in my zip code year-round? If you can answer all 10 questions for every plan you are considering, you will never pick the wrong Medicare plan. One final thing before you go. Do not let an insurance agent answer these questions for you. Agents are often paid higher commissions for certain plans. That does not mean they are giving you bad advice, but it does mean you should verify every answer independently. Use medicare.gov as your primary resource tool. It is free, it is unbiased, and it shows every plan available in your area.
If you want help comparing plans in your specific state, drop your state in the comments below. Tell me your situation, how often you visit doctors, what medications you take, and I will point you in the right direction. I read every single comment, and if this framework helped you, share it with someone who is about to make this decision. The wrong Medicare plan costs thousands. The right one costs almost nothing to find. I will see you in the next one.